Yeah. Now, what's happened here is this is kind of the follow up to what happened with URI meds. So the history behind URI meds is that they came on the market a few decades ago for adults, and there were studies done in adults showing that antihistamine decongestant combinations work in adults. There were never any systematic studies done in children, and it was never FDA approved in children. But what the drug companies did basically was they slipped it under the door, and for decades, the cough and cold medications have been used for very, very small children, despite the lack of any data showing that any efficacy. And in fact, multiple studies, and I remember hearing these studies being quoted back when I was in my residency in the 80s. Multiple studies showed no benefit from cough and cold medications. When I was in Baltimore, we had many discussions about this, and we taught the house staff, don't use cough and cold medications in kids. And we all felt frustrated because we saw all these kids coming in with them and there was very little we could do about it. There was a move undertaken by Janet Serwin. Janet is one of the faculty members at Hopkins from the General Academic Peds section. And Janet and a few others in the General Academic Peds department or section decided finally about 10 years ago that enough was enough because they'd seen enough damage done by cough and cold meds. They went ahead and gathered all the data, and they found about 15 or 20 kids that were documented to have died, probably as a result of cough and cold medications. They then also went back and documented the lack of FDA approval and the lack of studies showing any benefit for these medications in children. And they went to the FDA with the whole package. And they said, this is ridiculous. This needs to stop. Finally, about 10 years ago, the FDA agreed. This needs to stop. That's when the cough and cold meds were taken off the shelf for kids under 2 years of age. There's two reasons. Number one, they don't work. Number two, they can be dangerous. Now, the kids who died were all less than 2 years of age, as I recall. So I'm not going to go as far as to say to a parent that a 3-year-old is going to die from a cough or cold med. What I tell them is under age 2, they don't work and it can be harmful. Above age 2, they don't work, but there's not any good data to show that they're harmful for those kids between 2 and 5. So if the parents want to try it in an older child, I'm not going to stand in their way and I'm not going to badmouth their physician for using it. But if a kid comes in at 6 months and has been put on an antihistamine decongestant combination today, I am perfectly happy to tell them that that doctor should never have put their child on that medication. It doesn't work and it can be harmful, and I will tell them to stop the medication. I didn't do that before all this happened 10 years ago because we were we had strong opinions about it, but there wasn't, we didn't have a real firm ground to stand on. Now we do. We can we can say to parents, look, this was a bad recommendation. You should not be giving your child antihistamine decongestant combinations at age 3 months. And I've seen kids come in with 2 different antihistamine decongestant combinations at 3 months, which, as far as I'm concerned, borders on criminal.
So before we move to the next question, one thing that some people have been using in non-neonates is honey. Remember that you can't use this in really young kids because of botulinum.
Less than a year, you should not be giving them honey.
So if they're older than that, sometimes, and there's not great data on this, don't tell people, oh, you're going to take honey and the kid's going to completely stop coughing. That's not true. But there's a little bit of data that may slightly decrease cough. The agave nectar study, they basically did a bunch of arms of we got sugar syrup versus agave nectar versus something else. And it turns out if you swish almost anything in your mouth, things got a little bit better and people kind of liked it, but the pain scores didn't change that much. It's not harmful. I think agave tastes awful. Tequila is disgusting. And really the agave syrup that they're talking about is not pleasant at all. If you ever try a little sip of it, it's gross. But if people want to try it, I don't think it's harmful.
You need salt around it.
You salt the bottle nipple and then okay, got it. All right, who would you have a question?
I just wanted to add I saw a cool blog thing the other day on ER Pharmacist. The Cipro-Odic drops are apparently really expensive, and if you prescribe Cipro-ophthalmic drops with the same exact concentration, it's half the cost, and you can tell the patient to put it in their ear.
Nice. So, little pearl, apparently, you can try the ophthalmic Cipro drops compared to the ear drops. I think without insurance, when I checked, it was well over $100 for Ciprodex drops, which is a combination steroid and Cipro drop, which is way too expensive.